A middle-aged poultry worker with fever, cough, and fatigue. A 45-year-old poultry farm worker presented to the emergency department with a 5-day history of fever, cough, body pain, and fatigue. She has a medical history of asthma and is a smoker. She also reported experiencing shortness of breath, sore throat, and fatigue. Despite taking over-the-counter medications, her symptoms worsened. Additionally, she noted that there was unexplained reason of other poultry workers experiencing similar symptoms. On physical examination, her vital signs were noted as blood pressure as 135 by 80 mmHg, heart rate of 105 bpm, respiratory rate of 22 breaths per minute, oxygen saturation of 91% on room air. The patient appeared fatigued. Cardiovascular examination reveals tachycardia with a regular rhythm. The respiratory examination showed bilateral crackles and wheezing with the use of accessory muscles. A complete blood count indicates an elevated white blood cell count. A chest X-ray revealed bilateral infiltrates suggestive of viral pneumonia. A nasopharyngeal swab tested positive for H5N2. The patient is alert and oriented. Laboratory investigations reveal a hemoglobin level of 8.5 gram per deciliter, hematocrit of 25%, a mean corpuscular volume of 70 femtoliters, and a red blood cell count of 4.0 million cells per microliter. His iron studies indicate low serum iron levels, ferritin, and increased TIBC. Additional tests for occult blood were negative. What is the primary cause of this patient's presentation? A. Pulmonary embolism. B. Bacterial pneumonia. C. Avian influenza. D. Chronic obstructive pulmonary disease. Click on the link in the description below to learn more about this condition. We publish weekly cases that are challenging and engaging. Follow us so you don't miss out.